I don't have a window, so I don't even know if it's snowing or not. Story of my life.
All right,
John, you're good to go.
all right. Thank you very much. Hello and welcome to our 7th regional report out call. Today is January 26th. This is for the Southwest Kansas region. We're grateful to have you with us. We're here on Tuesdays at 4 o'clock. And we got a lot to pack in today's call. I'll go through our dashboard as usual. We'll kick it to Jeanette to hear about public health. Then over to Mary and her special guests around hospitals. Dr. Watson will talk to us about the transfer situation. We have Dr. Marcy Nielsen, the Chief Advisor on COVID-19 Coordination for the state. Great alliteration in that title. And she looks very angelic with the light behind her head today. So got that going for us too. Anyway, let me kick it into the dashboard and we can go from there. Sorry. All right. Okay. So I found it helpful to look back a couple weeks on this dashboard just to get a sense of the trends. I do want to make one clarifying comment after last week. So we've always been looking at the critical staffing shortages anticipated. This was a big deal in December in particular and has gotten a little better as we've come into January. But I want to make sure that people understand hospitals are marking this when they have critical issues. It doesn't mean that they're not having staffing issues. And so it doesn't mean that 94% of hospitals are doing great and 6% are having issues. There's a lot of places where we are asking extraordinary amount from particularly our nurses to cover extra shifts and extra patients and things like that. And so just want to make sure we're communicating the right thing. This is a critical staffing window here. So when we come and look at hospitalized, confirmed or suspected COVID patients in the Southwest region, looking over the last 3 weeks, so you'll like these trends. 55 2 weeks ago, 39 last week, 29 this week. So heading in the right direction, Southwest Kansas. ICU beds with COVID patients, 9 2 weeks ago, 11 last week, 6 this week. And then available ICU beds, 9 2 weeks ago, 4 last week, 8 this week, giving us 36% availability. And then I really like what we're seeing here. I mean, we have not seen a weekly case number this low, 231, for some time, and certainly not on this graph at all. And to give us an idea of how meaningful this is, I pulled up the KDHE website that they put together for us on positivity by region. That's the number of people taking tests that are test positive for COVID. So ignore this last row. It's kind of in the making, low numbers here at the beginning of the week. But last week, we were at a 5.2% positivity rate for Southwest Kansas. You have to go all the way back to March to get that low of a number for a week. So that's just that's a wonderful news and wonderful achievement. As you kind of look at the road that Southwest Kansas has been through over the course of this last year. Obviously, we want to see a lot of those yellow dots in a row. We don't want to let up our action, but we are seeing good news for the state and the lowest total positivity rate as a state, that we've seen, since the early October stages. So that's all good news. And that's the dashboard. Now let's bring it to life with real people doing real things. And so I'm going to kick it to our friend Jeanette to talk about the public health side of things. Jeanette.
Thank you, John. For public health, right now we're just really focusing on the phase 2 guidelines of vaccination and getting those priority people vaccinated. So anybody over the age of 65, the high contact retail workers, those with critical health conditions, the vaccine's coming in 100-dose increments. And so many health departments have started lists and, that as you're on that list, you get a phone call and an appointment is scheduled when the vaccine is available. I know many health departments are doing priorities, meaning that, you know, the bigger counties are looking at like maybe those that are 80 and above and targeting that population first. So we are still getting COVID cases. As I look through some of the other counties, you know, everybody's kind of seeing a decline. For Hodgman County, we did have a little bit of an increase this week. On Friday, we were down to 1 active case, and as of today, we have 5 active cases. So a few increase over the weekend, but you know, not near as much as what we were seeing clear back in October. So pretty much all for public health is most everybody's focused on vaccinations and getting those out to the public. So
Yeah, thank you, Jeanette. And you made an important point. You know, across a lot of the counties in Southwest Kansas, it's coming at least last couple of weeks in 100 count increments. You know, as a state, we have somewhere between 800,000 and 1 million people that qualify in phase 2. And as a state, we have 45,000, or that's consistently what we've averaged per week. So just urging people to have patience as the vaccine rolls out or kind of drips into the state. And we're hopeful to see that amount increase here over time. But that's what's happening right now. Jeanette, do you have any sense that across the region, is there a consistent approach on how counties are prioritizing inside of phase 2, or is it really county by county?
Most people are focusing on, you know, the 65 and older population. So, you know, looking more at their higher risk, the 70 and 80-year-olds, trying to get those vaccinated first. But it does vary a little bit by county. So
yeah, and that's why we always want to encourage people, you know, really look at your county health department's website, their Facebook page. If you can't get your answers there, then call. But it is really county by county that's kind of prioritizing inside of phase 2 and what that looks like. So check your local county health department. Let me turn it over to Mary here. Jeanette, thank you for that update. Let me kick it over to Mary to give us some perspective from the hospital side of things.
Thank you, John. Excuse me. My name is Mary Adam. I'm the director of the Pioneer Health Network based in Garden City. Today I'm representing the 18 counties and the 18 hospitals in the Southwest region. I just wanted to note on the dashboard that John went over for our region that the ICU beds last week, 50% of those were taken by COVID patients. This week, it's only 27%. That's a good thing. I do know that at least 2 of the patients in ICU expired. But I just want to encourage and remind you that we need to keep those ICU beds open for the 37% non-COVID patients that are in those right now. Once a COVID patient gets into the ICU, it's for an extended period of time. And we're going to be needing those beds with the winter months and the other things that are coming down the pipe with viruses and everything. So be vigilant with your hand washing, and even if you've been vaccinated, remember to watch the distancing and all those things that we've been hearing for so long. This is a critical time for our hospitals, I think. Our positivity rates are going down in most of Southwest Kansas. But like Jeanette said, it's always fluid. You know, those can go up in just a matter of a day or less. So we're keeping an eye on those. We have had single-digit positivity rates in Finney County here in Garden City for the last 2 days. That's the first time that I have seen that in months and months. So that's a good thing, and hopefully will continue. Some of our facilities have eased their visitor restrictions, which is a good thing for the patients and the residents in the long-term care. They're letting one person come in and see patients a day. where it has been no visitors. And that is part of the healing process for the staff as well as the patients and the family and the communities. So that's a good thing. We, as I'm sure the rest of the state and the rest of the country, are experiencing some concerns about vaccine and when we're going to get it and how much we're going to get and all those things that we need to deal with as far as providing the vaccinations to our phase 2 group. Here in Finney County, there was just a press release yesterday that from the Finney County perspective, they're working with the hospital and one of the clinics, the big clinics here in Garden City to coordinate, but they have just received theirs, and their priorities are going to be those from phase 1 not yet vaccinated, the first responders, which includes law enforcement, firefighters and corrections, licensed clergy, and people age 65 and older. So that is the group that Finney County will be prioritizing, and they have an online registration form that you can register to get scheduled for the vaccine. So as Jeanette said, each county is different, but this just came out, so I thought I would bring light to that for the Garden City and the Finney County residents. And I did read something else that I thought was of interest today, again, back to the vigilance, is that 1/3, a recent study just came out that 1/3 of positive COVID patients are not symptomatic. And so, you know, you might not even know you're sick, so just be vigilant. That's the end of my report. I am very pleased to present 3 of our staff members from Mineola Health Center. It's located in Mineola, Kansas, which is south of Dodge City. Mineola is a critical access hospital, a very progressive, very, very busy hospital that has a wide range of services. They have an emergency room, a rural health clinic, a long-term care unit, and several different services that they bring into their residents there in Mineola and Clark County. So I'd like to introduce Samantha Gillis. She's the Chief Operating Officer. She's also has her doctorate in physical therapy and serves as the Director of Therapy there at the hospital. We also have Pam Ediger, who is the Director of Nursing, and Shannon Brown, who is the Infection Preventionist. So I thank you ladies for being on today, and I will turn it over to you to share your experiences there at Mineola. Thank you.
Thank you, Mary. I'm Samantha. Pam's to my right and Shannon is to my left. Can you guys hear me okay?
Yep.
Okay. So with COVID, we have found a lot of areas here in Mineola that we needed to improve on. One of which is our space. So we only have 1 negative pressure room right now, and we're an 18-bed critical access hospital. So we're in the process of getting a second negative pressure room for patient safety and infection control measures. It has not started yet. We've had to modify our waiting room to be a triage room and treatment room for BAM administration. We've also converted our education building into storage for PPE, and we've also added a sick clinic onto that so that our sick patients who cannot just do telehealth visits are actually being seen by a provider, but can be spaced out from everybody else in the facility. It's got its own entrance, which has worked very great for our organization. We've also realized that our OR traffic was an issue, as currently our pre and post-op space was performed in the inpatient units and had to go by the ERs and that triage room to get to the OR. So we are now in the process of building a separate pre-op and post-op space because of that infection control measure. So we've got a lot of stuff going on in here to help make sure we're safe for our patients. And with all the ICU beds being pretty busy, we've also had to purchase a lot of different equipment that we didn't have prior. We now have 2 different ventilators. We have 3 vapotherms and a proning pillow so that we can free up some of those bigger hospital beds to clear them out, and we can provide those services, whether it's in swing bed or other areas that is needed. Our nursing staff has done a phenomenal job at educating everybody on proper donning and doffing, ensuring new processes are being followed to ensure their safety and the patient safety. We are still challenged by being short-staffed. We can't get some agency to come and assist due to agency not wanting to work in multiple departments, as our nurses need to be able to work in the ED, the medical floor, and the med-surg floor. It is always a challenge, but more so right now with COVID. Some of the issues we have had with COVID is transfer issues. It has gotten better, but we had one situation where we had a cardiac patient who needed a cath lab because of a heart attack, and we had to wait 30 hours because no one had space for her. This, like I said, this is getting better, but we also are having issues now with transportation, as Clark County is all volunteer EMT service. So some of them are not able to do transfers for us, and if they need to go out of the area, they can't always do that. So we're hoping that improves with time as well. As far as our long-term care, with us having a long-term care unit, we are in the yellow now as far as positivity rates. So we are starting to allow scheduled visits for our residents, and they can start eating meals in the dining room. This is a huge benefit for them. With me being in physical therapy, I see the physical, mental decline that it has had of them being locked in their rooms when we're in that red phase. So it is showing a great improvement for them. We do have 21 out of the 26 residents vaccinated now, and a 22nd resident is now going to be vaccinated this week with some of the 65 and older population that we're doing in phase 2. For our vaccine updates, we received our first Pfizer vaccine in mid-December and started vaccinating staff around December 17th. We have about 68% of our staff vaccinated at this time, which is a great number. We want to get that over 70 to work on getting herd immunity. And we have now started phase 2 of the vaccine administration. We started last week, and we had a clinic with our most high-risk patients that our providers recommended to us, and we got about 50 in. We found out this morning that we're going to get another dose from our health department. So we've been calling all day. Shannon and Pam have been working very hard to get all those vaccines accounted for, because we have a waiting list of over 200 people that have just called and asked for it. What's hard is we do have all their high risk, but they're just not in that 65 and older category yet. So we're trying to follow all the proper channels. The problem that we have is getting enough of the vaccine, as it has to go through our county health department first, who then has to divvy it up between 2 different facilities because there's another hospital in our county. But we're hoping that gets better. As far as a bright spot, some great news is our community members were immensely grateful to receive the COVID vaccine. One of our providers came to the vaccine clinic and talked to each and one of the vaccine recipients. Each of the community members felt so much at ease with having a provider there. They just couldn't stop thanking our hospital for that. And we have worked with the collaboration of the city and the school from the beginning. And the community has just provided so many thank you cards and words of encouragement to our hospital that it's great to live here.
That's a great story. I love the bright spots there. Thank you for gathering those and sharing them. And, that connection to community, I think, is really important. As I've heard so often on these calls that the nurses and doctors are caring for their friends and neighbors and these people that they know. And so to receive gratitude and kindness from the people that they're caring for, I'm sure creates a virtuous cycle and circle there of gratitude. And Mineola is a great place to live. So thank you guys for caring for that population.
Thank you,
I'm
Lady.
going to pass it over to Dr. Watson real quick so he can talk about the transfer situation. He's from Cheyenne Mountain Software and has been with us before. And Dr. Watson, why don't you give us an idea of what's going on?
Yeah, great. Well, just an update on state capacity. We're seeing a lot more availability of beds. Obviously, there are places that are tougher. Wichita region, tough. Northeast part of the state, a little bit tough. but Southwest has looked really good, and I think the word across the board is that it's looking better. Numbers of transports relatively the same. We're seeing fewer and fewer problems finding beds, and we're seeing fewer positive COVID patients moving. Most of the patients that are moving are actually normal patients that we would see in this time of the year, with the exception of influenza. I think, again, that was stated on earlier call that the measures that we've used to counteract the COVID pandemic work for a lot of infectious disease, and the influenza story fortunately not been as a factor as much in this time frame. So very grateful about that. But most of these transfers, again, were about at an hour for non-COVID patients, close to 2 hours for COVID patients. And like I said, really easing up on capacity, with the majority of patients being non-COVID variety. So good news, getting back to some things that look very normal in Southwest Kansas. I think the question will be, what will be the background COVID load that we're going to see over the next couple months? How low will it drop down? And what will we do as we prepare for the coming spring and that sort of thing? So good news for now. Keep our eyes on the future.
Thank you, Dr. Watson. We have a very special guest, as I mentioned at the beginning of the call, Dr. Marcy Nielsen, who's in her first week as full-time on this. She's been working on it part-time with the state. She is the Chief Advisor of COVID-19 Coordination for the governor in the state of Kansas. And before she gets going here, let me, Dr. Watson, if you can make me the host again. I'll show everybody a website we talked about last week, kansasvaccine.gov, and what we have going there. So they retooled the dashboard just a little bit, so I want to show it again. So if you come here and you click on data, this pops up for you to look at and see how many people have been vaccinated, first and second doses across the state, the doses as they come into the state, and then the population, percent of the population that's been vaccinated. This was 3.5% last week. It's 4.5% this week. Then a little census of who's been vaccinated by age, gender, if they were vaccinated by Moderna or Pfizer. And then by day, you can see first and second doses as they're going out, into the world, or into Kansas in particular. I found this to be helpful too. They added a distribution by county on here, so you can see your, what's going on with your county. With Finney with 400 doses this past week, and Ford with 400 doses. We were talking about Seward County earlier, 300 doses. It's important to remark, that, and I made this point earlier, I guess, that these doses, they trickle into the state, 45,000-ish a week to tackle a population in phase 2 of 800,000 to 1 million. It's going to take a while, and each of these counties has developed a plan and should be communicating with their area about how to get vaccinated and when it might happen. Let me pass it over to Dr. Nielsen to add a little color and update on the vaccine, and to take any questions.
Thank you, John, and thank you for sharing not only the information in the dashboard, but information that you've been sharing across the state for these many weeks. Thank you to all of you who have been taking care of patients. My hat goes off to you. Most of my best friends are providers, and I couldn't really handle the blood in stuff, so I went into public health. So I appreciate it very, very much. As John mentioned, I'd been helping a bit on the testing front. I think we all recognize that vaccinating all Kansans is going to take an effort like we've never seen before. And based on the current vaccines, it's not just vaccinating the population once, it's vaccinating them essentially twice. And when you add in the complicating factors of, at least on the Pfizer vaccine, the cold chain, when you factor in that the federal government to date hasn't coordinated at the individual level, and maybe not as well even at the state level, you recognize that we at the county and the state level have a difficult job in front of us. In terms of what we know on the ground today, as you all have been talking about, things have started to stabilize. Getting enough vaccine to all of the individuals who qualify in phase 2 is going to be hard. We absolutely have a shortage. It's the whole reason that we moved into phases in the first place. We, not unlike the CDC, we prioritized folks for each phase based on their risk of sickness and death. So we start with those most vulnerable folks, and certainly the healthcare workers who are taking care of patients throughout the state, part of phase 1, and the long-term care facilities. Phase 2 is a bit more complicated. Those individuals over the age of 65, those in congregate settings, and those who work in jobs that put them at close exposure to others with COVID. Now you start needing to do some math, and we are using an allocation formula based on population, based on geography, based on providers' capacity to handle the ultra cold storage requirements. And also with an eye toward social vulnerability. We know COVID has disproportionately impacted communities of color, and we want to be able to get the vaccine out to populations who are at the highest risk of illness and death. What we know from the federal government is that they are moving toward trying to centralize more of this work. We know that they are wanting to increase the amount of vaccine, and we applaud them for that. But until we get more vaccines, right now we've got 2. In Europe, they've got 3 and 4. So we need more vaccines to go through the FDA process in order to get us there. I will say one thing that we get a bit fixated on, and this just isn't Kansans, this is everybody, is kind of comparing ourselves and the number of folks that we've administered vaccines to what the CDC is saying we've done. And what I learned on a National Governors Association phone call just earlier today is, in fact, we're not the only state where numerators and denominators don't line up with the CDC. So right now, I want to emphasize that Kansas is about the middle of the pack. We want to make sure we get our fair share of vaccines. And I just want to thank you all for all of your service to taking care of those who have gotten sick.
Thank you, Dr. Nielsen. Really appreciate you giving up your time. I know you have a lot of things you could do. Any really quick questions? We've got 2 minutes here before we need to wrap it up for Dr. Nielsen.
It's very helpful that Samantha has a clock behind her head, because that was my only indication. John starts getting a little twitchy, but suddenly there was the clock.
Well, that's great. And Samantha gave us a great bright spot just during the how the community's cared for you guys and some of the things that are going on there in Mineola. I want to thank everybody for jumping on. I'm going to give you our websites here, covid.ks.gov/report-outs if you want to sign up for the email on the dashboard. If you have questions for us, ksregionalreport@gmail.com. Vaccine information, kansasvaccine.gov. And if you want to find a free testing site, gogettested.com/Kansas. And just thank everybody for being here. We'll be back here next week at 4 o'clock to hear about